Welcome back. This month, we are bringing awareness to breast cancer awareness. It impacts about 1 in 3 women. When someone is diagnosed with the disease, it has an effect on family, on the patient, and of course, survivors. With patients not only dealing with physical symptoms, but emotional symptoms as well. And here this morning to talk about how you can cope through a diagnosis is Dr. Elssy Oms. Thank you so much, doctor, for being with us. And it is so true. You know, as a patient, you're dealing with this, but then perhaps you have a husband, young children who also have to process all of this. So let's start with the patient first. What kind of emotional toll does this take on them getting this diagnosis?
Right. As we all can imagine, it takes a very big toll on the patient. It's a transforming diagnosis, a life-changing diagnosis. How you will respond as a patient is individual. Well, what we tend to see sometimes is that a sense of panic sets in. Patients try to do everything they can at once. Your mind can wander either to past things, what did I do, what led to this, or the future. How is my life going to look like if something happened to me, or what's my family going to look like? So it's important for patients to stay present in the moment. What we recommend is mindfulness therapy. Process the information that your physician is giving you. Try to establish a strategic plan of how you're going to deal with the illness and what the future will look like. Identify caregivers, or at least one point of contact, because there's going to be a lot of legwork involved in getting all the resources in place.
And I would imagine it's almost like you know, the stages of grief, if you will. One minute you're shocked, and then you're scared, and then there's always the fear, because this can be deadly.
Absolutely.
And so how do you help patients process those stages?
Yes, very much like you said, they are now confronted with their own existence. So it's important because family and friends, they tend to want to help, and it comes from a place of sympathy and love, and they could say things like, it's going to be okay, you know, everybody gets depressed, or, you know, we know what you're going through. So try not to intervene in that way. Try to be a sense of support, just being there and letting them know you're there, so that when they are ready to reach out, they will reach out to you. It's also important to take care of yourself as your family member or friend, because I always let them know you can't help others unless you help yourself first.
And there are definitely resources out there, yes, for the patient, but also for family and friends, because you do in some cases become this caretaker, and your life changes too.
Absolutely. And the patient was sometimes the main role, the caregiver. So now they're changing roles in their life. And so dealing with that transition is important to have therapists, counselors, psychiatrists, reach out to as many providers. Start with your own oncology team. Sometimes they're set up with the providers simultaneously when you get the diagnosis.
And a lot of times you think of what the physical toll that breast cancer and the treatments have on your body, but the mental health in all of this, and protecting your mental health and keeping your mind strong, just as important when fighting this.
Yes, research has shown that that making mental health a priority in the treatment for cancer increases survival rates and also increases remission rates.
It's pretty impressive. Anything else you'd like to make note of? Anything you'd like our viewers out there, because unfortunately so many of us have been touched by breast cancer, whether it be ourselves or our family members. Anything else you want to make mention?
To take your time. Everybody goes through this at their pace, in their own way, and to always try to reduce the stigma related to mental health. The more we incorporate it, the more we talk about it, the more we feel comfortable bringing it up with ourselves and our friends and family members, the more likely we are to reduce it and increase all the good outcomes for everyone.
And there is help out there. There are resources, there are services. We're so lucky here in our area that we have doctors like you, we have resources, and because so many people have been touched by this, there's so much out there. So there's no reason to suffer alone,
Absolutely
that's for sure.
not.
Thank you for all you do. Thanks for joining us and giving that information.